DMH is doing more here to improve the lives of patients in Central Illinois. We bring you the latest initiatives through DMH Newslink.
DMH Newslink.
This is DMH Newslink, and I'm Michaela Hunt. We're joined today by trauma surgeon Dr. Omar El-Sheikh, who works in the Trauma Care Center here at DMH. Thank you for taking some time and spending some time giving us your insight today.
Thanks for having me.
So exactly what is trauma care? What can we tell folks?
Trauma care involves treating injured trauma patients who are involved in major traumatic injuries. Trauma is the leading cause of death in the ages of 1 through 44 years old. By far exceeds cancer, stroke, heart disease, heart attacks, everything. All of these combined do not even surmount to injured or death from trauma in this age group. Typically, trauma harvests young lives, and basically the years of life lost and the disability that ensues really show the importance of good trauma care within the golden hour of trauma care.
So tell me, given that, what are some of the advancements that you're seeing in trauma care right now, and how are you applying them here at DMH?
The advancements in trauma care that occurred over the last decade or so was the institution of damage control surgery. The trauma surgeon fixes what really needs to be fixed at the moment and can literally leave things unfixed and even leave cavities open for further exploration and repair for later days. The whole concept is basically have the patient live today in order for him to fight another day and be able to be repaired definitively. This model has been used extensively in the military. Basically, they found that their survival from the old-fashioned way of doing things, where they wanted to fix everything, went from 11% to over 70%.
Wow,
for the
major
same
change.
Mm-hmm.
For the same care, just triaged a little bit differently for the overall trauma injury.
For the same injury severity scale.
Got it. And so with the Level 2 Trauma Care Center and having that in this community, why is that so special? Why is that important?
The distance that you are away from a trauma center negatively impacts your survival. So having a trauma center in your backyard is actually a very good thing, because this means when you suffer a major trauma, there's somebody there to take care of you. There's a team approach, a whole team of nurses, respiratory therapists, trauma surgeons, ER physicians, and surgical subspecialists, all available and on call and are there to take care of a major injury trauma.
And in those moments, you want a team that's working for you, given what you're going through and what your body's going through.
Absolutely. It's the team approach that really defines everything.
Dr. El-Sheikh, thank you so much.
Thank you.
And for more on this and other health stories, just go to dmhcares.com/news.